Let's go to loyalty and advocacy as we get towards the end of this. How I want to look at what's around the telehealth visit. We talk a lot about the physician experience, the physician patient consultation and spending time with them. And I know all that's extremely important. We've already established that. But what about the complexity of the overall process, the technology aspect of it, the payment aspect of it, the follow up and connectivity into the workflows afterward? Did that lend itself to either being a dissatisfier or satisfier?
Yeah, so the way that JD Power conducts all of their business around rankings and awards and research data and analytics is through our modeling. So we have a JD Power index model that is a proprietary built driver of satisfaction where we understand the consumer satisfaction and sentiment. When we started the telehealth work, we started to field the responses. That's when we go through sort of our data processing and we understand what are the drivers of satisfaction. Then our models are built on that credibility of what the crowd is telling us. So for telehealth, we break it up. 42% of our model is driven by the customer service element of it, which is what is the overall technology experience, the phone, the video. And then the second most important thing, as I mentioned earlier, what consumers are telling us is the actual consultation, the experience that they have with the provider. There we're looking for the quality of the service, timeliness, convenience, what was the dialogue and the experience between the consumer and the provider. And then it's getting into the traditional payer side, which is the actual level of enrollment. How easy was it to find a physician? How easy was it to actually conduct the visit? What was the appearance of the website or the app? The speed of the pages loading, things of that nature. And then finally, billing and payment, which is the clarity of the billing process, the amount of time given to your bill. All of those elements go up into the total satisfaction. And as I mentioned before, the model is heavily built right now around customer service and consultation. And so as time goes on and consumers tell us there's more important things than others, we will weigh the actual credibility of the model. So right now, again, it's focusing on the actual consultation experience and then the customer service element of it.
So I think, and that really answers the question of how do you drive loyalty and advocacy? Well, our loyalty and then people advocating for your program, consumers actually telling other consumers about your program. And you're saying focus in on those core areas, and that is how you drive loyalty and advocacy. Is that accurate?
Exactly. And I would say one major significant finding that we found last year and we found this year is the differences in satisfaction between consumers who tell us that their healthcare is poor and the consumers that tell us that their healthcare is excellent. So we ask a series of questions around their clinical condition. And on a 1,000-point scale, those that said they had a poor condition rated the telehealth experience at a 783. Those that said they had an excellent healthcare or excellent health, their ratings were 900. So we see a 117-point difference between those that are high risk and those that are low risk. And so again, what we know in healthcare is managing poor health populations require more time, more literacy, more engagement. And so I think telehealth has a profound opportunity here to reach into those populations that need greater access around resources, time, education, and overall healthcare literacy. So that was one major point of our data that stood out last year, and it stands out this year.